This question states, in the context of a telehealth or virtual visit, which of the following conditions might be appropriate for assessment? So when you think of your telehealth, which is speaking with the provider in a virtual setting, you're not physically coming into the office, you want to think of conditions that aren't very emergent and conditions that don't require testing or imaging right now at this very moment. You might need it later on. They might ask you to come in to get something done, but this is just for your initial consultation. So we're looking for not emergent and not imaging / testing. So let's look at the choices. So option A states a broken bone. So a broken bone would be something that you definitely need to go and get an x-ray for. An x-ray, that's how you would determine if the bone is broken, and then you would need to go get a cast, and then, or some sort of boot, or some sort of treatment, or something like that. But that's not something that could be done in a virtual telehealth setting. There's no x-ray in your house. There's no way to get proper treatment afterward. So this would not be a candidate for telehealth. Option B says symptoms of a common cold. And yeah, oftentimes people will go on telehealth visits if they can't come into the office, and they will discuss the symptoms they have. And then from there, they might need to go in if the provider feels they need to get some sort of swab done, maybe a throat or nose one. But for the initial consultation and the history taking information, they definitely can begin the process in telehealth if they wish. So this seems like a good option. Let's go with option B. But let's look at the other choices as well. Option C, severe chest pain. So anytime you see severe, that should raise a flag in some way. In this case, severe raises a flag for you to think, gee, maybe this is more serious. They shouldn't be going on a telehealth. They should be going straight to the emergency room. Emergency. And when we were talking about criteria for telehealth, we put not emergent. And this does sound emergent. So this would not be a good candidate for a telehealth visit. If they contacted the provider, they would likely tell them, call 911 right away. Option D states a large open wound. And remember, we put here not imaging or testing. And in addition to testing, we could also put actual treatment that would be physical. In this case, some sort of wound care, maybe they need a wound culture. This also sounds a little more serious and more of the physical nature, meaning that they can't just be treated from a virtual visit alone. So we can eliminate option D. And that leaves us with our initial idea of option B, symptoms of a common cold. That would be a typical telehealth type visit.